This is HighIntensityBusiness.com with Lawrence Neal, helping you achieve your health and fitness goals. Become a great personal trainer and build your high-intensity strength training business.
Lawrence Neal here, and welcome back to HighIntensityBusiness.com. Today's guest is Patty Durell. Patty is an exercise and self-care coach who is extremely passionate about empowering and challenging people to be their best. She is also the founder and CEO of Rock Solid Fitness, a thriving personal training studio in Dunedin, Florida. Is that correct? Did I say that right? Dunedin, that's it. Oh, we even practiced it before and I still screwed it up. Through her younger years, she battled depression, addiction, and being overweight. And in her mid-20s, she learned that if she was willing to fail but didn't give up, she was capable of accomplishing things that seemed impossible. She learned this through a strength training program called High Intensity Training. Sounds very familiar. And over the past 25 years, Patty has coached thousands of people to improve the quality of their lives through this same program. Patty first started as a physical therapist assistant, helping people overcome life-changing orthopedic and neurological events. She currently educates and inspires her team, her community, and audiences throughout the country on topics of leadership, time-efficient and safe exercise programs, as well as how to be in optimal health through self-care. Patty is a master-level personal trainer, certified conditioning specialist, and licensed physical therapy assistant. She has been featured on many business and fitness podcasts like this one, TV and news magazines. Patty, welcome back to the show.
Thank you so much for having me, Lawrence. I love being here with you.
You're most welcome, and I've been looking forward to chatting to you again. And I'm quite annoyed at myself for screwing up part of the introduction, but we'll let that slide.
It's so common. It's great the way we hear it pronounced differently. It's great.
I have a bad habit of doing that, of screwing up the intros when I mispronounce a word. So, as I said, really looking forward to having this conversation. The subject we're going to talk about today is something I'm really interested in, something I've had some, personal experience with. And we're going to be talking about how to reduce shoulder injury risk. You did a fantastic rapid presentation at this year's Resistance Exercise Conference that was really informative. And, straight after you gave that talk, I was like, well, look, I didn't have any time to take any notes because it was done so quickly. So I must get you on the podcast to talk about it in more detail. And obviously I've had an injury since as well, which, I might work into this conversation if it makes sense. So we've got a PDF presentation that you actually use when giving the presentation at Rec. And we thought we would use that just to give some structure. And I will put a link to that in the show notes. So if people go to the show notes for this one, which I'll mention the URL at the end, and they'll be able to get this presentation. So the first slide here is 3 shoulder exercises. And then the first image is the image of the shoulder joint. So can I just give you the floor, Patty, and let you start talking about, how you want to open this discussion on reducing shoulder injury risk?
Sure. I think, the first thing we have to talk about is just the fact that it is the most mobile and most kind of vulnerable joint in the human body. It's got a really large humeral head that barely fits into that glenoid fossa. It's anti-gravity, right? So it's not weight bearing. It's constantly being pulled on by gravity. And because it's so mobile, we tend to put it in positions, just even our posture. I'm sitting here, I'm checking my own posture right now. I'm a little slumped. My shoulders are a little forward. And so I'm already bringing that humeral head out of the socket. Like if we did that to our hip, it would hurt, right? But our shoulder can kind of just take that. So it's a very vulnerable joint to begin with. And I think we have to establish that.
Yeah.
So
awesome.
Do you want me to just keep going through this kind of the slides here?
Please do. I think that would be probably the best way to do this. I was just checking my posture there as you were saying that.
It's true, and a lot of times, I want to just mention this too, that oftentimes, especially when I was working in a more clinical setting, we would have people come in with shoulder pain, complaining of shoulder pain. And really it was a forward head that was stressing nerves in their neck that was radiating pain into their shoulder. So sometimes even when we think we have a shoulder problem, it's more of a posture problem, a weakness problem, or a forward head, posture, again, problem in your neck. So I think it's important to just first talk about the structure of that, shoulder. And because of that, we see really mostly overuse injuries, right? Like overuse sprains and strains, especially of that bicep and rotator cuff tendons. So, for us at Rock Solid Fitness, like one of our first things that our litmus test about everything is, is the risk worth the reward? And if the answer is no, we just don't do it. So there's a lot of things that we won't do to the shoulder joint that many people love in their exercise routine, just because we know that over time and as we increase resistance, because we do implement a progressive resistance exercise program, that strain on those soft tissue structures is going to increase and potentially cause a problem just through your exercise program. And we feel that exercise should help you, not hurt you, ever. And so we meet people now, in their 40s and 50s who have maybe a shoulder injury from their exercise program, overstretching, loading it, and then overusing it with that load and that stretch. So that's kind of that first picture, is just kind of demonstrating the anatomy of it and how it is kind of unstable, just looking at the bones. So in my talk that I gave at REC, I only really highlighted 3 kind of exercises or movements, if you will, that we feel are just imperative to making sure that the shoulder stays healthy over time. So those exercises I'll save for the end. How's that? Or we'll talk about that.
Oh, teaser.
But overstretching the structures, the most common way, Lawrence, I think that people overstretch their shoulder is really their bicep tendon. And they do that with a barbell press. They do that on pec fly. They do that on chest press. And we go through great lengths to make sure we set someone up in the beginning, so that when we're getting their arms into horizontal abduction or abduction, we're taking them into that stretch position in a chest press. We're making sure that their elbow doesn't come too far past the plane of their body, so that soft tissue, that long head of the bicep that sits in a real specific groove, doesn't get overstretched, because when it gets inflamed, it causes like an impingement problem and a painful problem. And that can lead to all kinds of bigger issues over time.
Just on, it's really interesting because I'm dealing with all this right now myself. With regard to things like the chest press, I've heard one way to look at it is, or one kind of thing to think about is to always keep your hands in your peripheral vision as kind of a litmus test for are your hands too far behind you? So do you think that's a good rule for exercises like that where you're trying to protect the shoulder?
I think so. I think as I think about that, I think that's a great way to look at it, Lawrence. I've never looked at it that way myself. It's always been like anatomical elbow to the side of the body, but I think that's great and easy and simple for people to think of. I would say that, no rule is hard and fast either. There's always gray in there. So if someone has a real irritated shoulder, or it is their bicep tendon in that position, to actually drop the elbow down to the side and do it in more of a like a vertical handle, if you were to imagine that on a machine, rather than having yourself in horizontal abduction, you could have yourself more adducted with your humerus by your side. And I think that takes a lot of that stretch or abnormal stretch off of the bicep, because it's in a more anatomically easy position, I guess would be the way to say that, with that bicep, if you imagine it in that groove on the humerus.
Yeah. And also makes me think of like the MedX machine. The MedX chest press has that kind of parallel neutral grip, if that's the right way to label that. And that does kind of force you to bring the humerus closer to the body. So that's probably a safer position if you've got maybe some shoulder issues. Is that fair Fair comment?
100%. So
Yeah.
like you, I have shoulder issues. And I have a MedX chest press and I cannot hold the horizontal handles.
Oh, wow.
And so I am a vertical handle. And we specifically have a chest press that has that option. We did not for a while. And we knew that, people that came to us with shoulder problems, we could not do that chest press except for in a very, very small range of motion.
Okay, cool. So, okay. Yeah. So I guess just going back to the presentation for a moment. So you've covered kind of first do no harm. You want to be doing exercises where you'll be able to do them over the long term. And as you do provide progressive resistance, you're not going to be compromising that joint or causing any sort of injury. And there's a great image in the presentation where you've got this very muscular young man who is attempting to do what looks like push-ups between two boxes. And again, this will be in the show notes for those that want to see the reference, but he's, what would you call that where the arms are so far behind the torso like that? It looks so uncomfortable and so dangerous.
That's like horizontal abduction. Yeah. And I don't even know how that picture just freaked me out, Lawrence. Honestly, when I saw that, I'm like, this is perfect. Yeah, this is perfect. I'm not even sure what you would call that position except for awful. But, in preparation for this talk with you today, I was thinking about one of the many, many commercial places I worked out of before I had Rock Solid Fitness. I met this very wise retired orthopedic surgeon, and he made a comment to me, and this probably was 20 years ago, 18 years ago. And at the time I thought, how silly of this guy to just make such a big blanket comment about the shoulder joint. And what he said to me was that you should never, ever raise your elbows up past your shoulders. He felt there was never any reason in an exercise program for your elbows to, in a pressing motion, not a pulling motion, but in a pressing motion to go up over your head. And he also felt like you should never, ever do upright rows. And I used to do those with my clients at the time, or lateral raise, or any kind of overhead press. And I thought, that's really severe. Like, that's really taking it to the other degree. But Lawrence, the longer I stay in exercise and fitness and the more experience I get, the more I think there's a little more truth to that. I don't think that lateral raise is always such a great idea for many, many shoulders. And anatomically, we don't get to look inside someone's through their skin and see what kind of an acromion they have to decide that. So why not just err on the side of caution? Upright rows, that closed pack position of that shoulder joint is just a terrible position for soft tissue to just get smashed between your humerus and your acromion, especially if you don't have perfect posture when you're doing it, or your acromion isn't the nice half moon rounded, shape that we would love it to be, but it's not in most of us.
Let's just pause there for a moment, because I have to ask a question. So this is really interesting, because I have a shoulder issue at the moment. I might as well mention it here just to give you more context as we talk. Overuse injury from basketball, tendonitis of the bicep tendon. Yeah. Well, no, not shooting. It's actually from trying to block. So I will swing my right arm in a big circle as I attempt to block someone. And I have a bad habit of, when I should be blocking with my left in a certain situation, I'll try and block with my right, and I'll really go for it. So let's say someone's in the corner shooting the free and I have to pop out to try and block that, or at least put them under pressure. I'll plant both feet, do a big jump and swing my arm through the air. And on a number of occasions before the injury kind of occurred, I thought, that feels uncomfortable, warning signs. And then one session I came home, it was a tiny bit tender, but wasn't too concerned. Woke up the next day and it was pretty debilitating is what I'm trying to say, and pretty uncomfortable. And so from then on, it's been a real problem. And I've not been able to strength train my upper body to the same intensity that I once was. And I'm sort of trying to rehab it now. It's a process I'm going through. But one of the things you mentioned there about lateral raises really interested me. I'm in my program at the moment, I've been doing dumbbell lateral raises. and I've been doing them very carefully in a hit fashion, very smooth turnarounds, very slowly, not using crazy load. But I've got to say that firstly, I cannot go to failure, and I can't really do full range of motion without feeling some discomfort in the shoulder joint. So do you think that, I mean, I know this is like, I'm putting you in a position now where you have to do almost like a remote diagnosis, but in my particular context, would you advocate someone not doing lateral raises to avoid during a rehab phase?
So if you were to come into Rock Solid Fitness,
you
would immediately be put on front raise. You'd probably be doing less weight in the arm that hurts you. You wouldn't do anything that hurt. Yeah, I mean, if we even saw the tiniest wince or you had that little, we would be like, you are not doing that. So you have to get that inflammation gone. You have to get rid of it. So
because it persists, doesn't it? It hangs around for
shoulders
ages.
are the worst. They are the worst. And so the most common injury is a re-injury. So you're going to have to, like we would say, we would never let you do lateral raise. We just wouldn't do it with you again in the future because the risk is not worth the reward. And the most common injury is a re-injury. Okay. So you will always have, like now that you have an itis, you have a tendonitis probably. I'm definitely not a doctor and I definitely don't diagnose.
It is. I've had a physio look at it. So yeah, it's
and that's an overuse injury, right? So they take a while to go away. So don't use it. Try not to lift your elbow up over your shoulder, but we would not let you do lateral raise. We would not let you do any kind of horizontal handle probably on the chest press if it hurts you.
I've been breaking all the rules.
Do you feel it on the chest press with those horizontal handles?
Not so much.
Okay, then
not
do
so
it.
Much, yeah. Okay.
If you have like, I feel it slightly, or I can tell that it's there, then I wouldn't do it. Okay. And then definitely never a military press where you're pushing up overhead in a military fashion, because if lateral raise bothers you, that's going to bother you too.
Mm-hmm. Yeah, absolutely.
And then of course it's more important about what you do instead of don't do, right? So doing external rotation to strengthen your supraspinatus and rear delt to strengthen the back part of your shoulder so that you can get your humeral head back and up into the glenoid fossa to make it more open. So when you do move your arm, it's not pinching.
Right. Yeah. I do I certainly want to talk more about that, but I'm just conscious that I want to try and do this in an orderly fashion as well. So just jumping back to the presentation for a moment. So we've got the picture of the chap doing the ridiculous push-up. And then you've got this picture, and I think this is a sort of like a metaphor, isn't it? Of the stream, like waterfall, with a huge rock in the middle, which is somehow upright. Somehow, I'm not sure quite how. What is that supposed to represent?
Kind of the shoulder joint, how it's just in this real, unstable, mobile environment, right? So that's kind of what I feel like the shoulder does half the time. We're trying to keep it in its proper alignment while it's moving all over the place and has this tremendous environment of instability.
Right.
We're trying to make it mobile. So
that's a perfect image for it, isn't it?
Yeah. And so, the exercises that we're talking about that will help you are the ones that try to make it a more stable environment and put it into proper alignment so that it creates a more open joint space so those vulnerable tendons and other soft tissue things can move around without irritation.
Okay. So in the next picture, you've got sort of an anatomical picture of the shoulder. Have you got anything to say on that, or should we move on to the next section?
Yeah, the only thing we can point out is where that supraspinatus muscle is, and that's important. And the rear deltoid, is important. Horizontal abduction and external rotation for strengthening exercises. And those two things, like we said earlier, will just kind of minimize the forces on the bicep and the rotator cuff, if it's more stable and more open.
Yeah, I'd certainly want to get into, we're going to the exercises now, aren't we? And I've got some other questions around this. So do you want to so you've got Dave doing, what do you call that particular exercise that he's doing?
That's external rotation. So we put him on his side. First, we put a towel or a pool noodle or a water bottle or something underneath the elbow to put the to put that into a position of scaption. So
what does that mean, scaption? What does that mean?
So scaption is a term we use for just making that shoulder joint more open. So it's literally about 55 degrees of abduction and 30 degrees of flexion. So that's like when the joint is most open and what scaption really means. But we just try to do our best if we're going to lay someone on their side, or if they're going to do it with a cable. We don't have a cable, but I've done it a bunch of times with people. I'll just have their water bottle or a towel underneath their elbow, just again to open that shoulder joint. So as it's rotating, you're making it open so that those soft tissue structures can move around without getting irritated. Understood. And so it's got to be anti-gravity, right? Because you're using a dumbbell and gravity is there. I've seen people stand up and do their external rotation exercises standing, and really they're exercising their bicep because of gravity and not their rotator cuff muscles really at all. They're just wearing that joint out, so it needs to make sense there. And then we have a Nautilus bicep curl. So you'll see in the upper right-hand corner where Drew is doing manual resistance with a woman, a client. And so we will just use that position again to get that shoulder joint in scaption. So a preacher bench works really nicely for that. And again, that's manually. So I just wanted to show a couple of different varieties of how you can rotate your arm out or externally rotate your shoulder and use your supraspinatus, your infraspinatus, and your teres minor muscles there.
Mm-hmm. Yeah, that's awesome. Just one comment about bicep curls. So it's interesting. So I went to see a physio in Galway recently, and she was actually, very knowledgeable, was very helpful, and I kind of came away with, most of the stuff she said I thought was great and were great recommendations. And then there was like 30% where I was like, just not sure if that's true. So I always run this stuff past my trusted network of high intensity training people. And Dr. Bryce Lee is probably, well, like you, Paddy, he's one of the few people who has a very strong background in physical therapy, but also high intensity strength training, which is quite unusual from what I've seen. He kind of validated some of the things that I thought about. And she one of the things she said is, you should try doing some bicep curls. And I thought, okay, I'll try that. And as part of my program that I've been doing at the moment that Gary Knight's been helping me with, I've been doing bicep curls when my elbows are against the wall in order to, as one of his recommendations for a certain bicep curl form that he advocates. And I the other day I thought, well, let's see how I get on with this. And after 3 repetitions, my right shoulder was like burning. Like it was probably more exacerbated from that than any other exercise. And I'm thinking this is a bicep curl, but obviously it is the bicep tendon that's going over the humerus that is inflamed and that's being activated. I mean, based on the litmus test you gave earlier, any sign of wincing, I mean, this was, well into the realm of experiencing pain. So I'm guessing you don't advocate bicep curls in these instances.
It comes back to what bothers you, right? It comes back down to that. So if you were doing bicep curls and it didn't bother you, great. But, impingement or itis of the shoulder is typically the bicep or the supraspinatus. It's typically one of those two structures. And the way that I usually learn that is through how people feel. So if you're wincing and you're having pain with bicep curls, I'm going to assume that it's probably your bicep tendon that has the itis in it. And then you're not going to do biceps, unless it's a lightweight and it doesn't hurt. And there's a lot to be said for that. So if you put, you make the muscle contract and relax, it's going to have great blood flow, which is going to promote healing. So yes, bicep curls that don't hurt would be great. A 3-pound dumbbell in your hand. Therapeutic, right? That's what physical therapy is for. So something that doesn't hurt, that makes the blood flow would be great. But I wouldn't put your arm up overhead and do a pull down, and take the risk of smashing that bicep up against the acromion because now you're up overhead. But that might not hurt you.
Yeah, I haven't had issues with that. I haven't had issues with pull downs. Yeah.
So then you're going to have to just use logic. That's, I don't mean that people aren't using logic. I don't mean to make that sound like people aren't logical, but just if it hurts, don't do it. And if you can just stick to that little rule, if it hurts, don't do it, and get rid of the inflammation, get rid of the swelling, the pain will go away when the inflammation goes away, and then slowly introduce your resistance. Cut everything back by 50%. And then start, once you can do 17 reps or 20 reps with your resistance cut in half, increase it by 20% or 30%. But, it's an itis. And itises are hard. And you're just going to have to respect your body and listen to your body.
Yeah, I guess it's a good time also to mention that, and I'd be interested to know how you address this in your shop, but in terms of how you distinguish between discomfort and pain, because I have been doing this for a long time, so I can distinguish between the two quite well, and I can figure out which exercises are not going to be appropriate. But when people first get introduced to something like high intensity training, they will sometimes stop at that when they feel a certain amount of discomfort, because they don't really know, they've never really felt it before. So they don't sometimes know how to distinguish it from, something that's a threat and painful. So I just wondered, how might you educate a client? So if you've got, because I'm thinking a lot of people can listen to this would be interested in this. So if you've got a client, let's say, who's got shoulder problems, how do you communicate to them to tell you when they are feeling pain versus discomfort?
So if it's one shoulder that has a problem, it's quite easy, because we can just say, if that shoulder feels different than the healthy shoulder, you need to stop, right? So you always have the healthy shoulder to be a reference. If you're feeling it bilaterally and it feels the same, well, then fine. But if, you're feeling different in the shoulder that has the history of an injury on it, then we don't want to go there. And it's hard, it's really hard for people who have been taught you got to push through the pain, or you don't talk about what hurts, or it's hard. The psychological aspect of people who want to hide their feelings and hide their pain, it does nobody good, especially in the world of exercise and trying to recover from an injury. Pushing through the pain is not good. Pushing through exhaustion, pushing through the feeling of wanting to give up, those are different. Pushing through discomfort, that's different. But when you have pain that makes you want to, and you know what that is, Lawrence, because you have shoulder pain. So when you're talking to someone like this, usually they get it and they know, okay, this is a familiar pain I've had in the past. And that's the words we use. Is it familiar? Does it feel like your injury? Is this the kind of thing that you felt when it was injured? Those kinds of questions and comments. But if it hurts, just don't do it. It's just not worth it. You'll create a longer time of recovery.
Yeah, that no pain, no gain thing is so problematic, isn't it? That kind of mindset.
and we are in that, right? We're in the high intensity training world. So it's hard when you're like, okay, you can't give up. We're trying another one. I'm going to force you through this rep. Let's go. And it's a hard thing to do when you have someone who has an injury. You have to take a step back and you have to be in the moment and be in the exercise with them, and understand that you probably have a person in front of you who won't give up if you tell them not to, and who will push through the pain if you encourage them to. And so that's where you have to step in and you have to put an end to that and say, we're not going to work at our usual level on this exercise. We're still rehabbing it. Or, if it's only one limb, let the other limb go to failure and push it really hard and just rehab the one limb.
Yeah. So I'm on the next slide here, where you've got Dave doing reverse flies. We haven't talked about these exercises yet, have they? Do you want to just kind of give a description of some of these? Yeah.
Sure. So this is kind of what I was talking about, posterior deltoid or the rear deltoid. Really, the motion is horizontal abduction, abduction, and it can be done in so many different ways. So yes, there's a rear deltoid machine that you can see Dave on. He's got the Seminole shirt on. And that's what most commercial gyms have. We do it also manually. You can see in the top left-hand corner, there's Drew doing manual resistance. So that person is laying prone on a bench. and her arms are bent. So she's just kind of doing a hugging motion in front of her and then bringing her arms straight up behind her. And then also with dumbbells. This is an easier way, laying on your, belly on a bench is just a little easier on the shoulder joint than the rear deltoid machine for some reason. When someone's really flared up, just putting them on their belly with no dumbbells in their hand. I encourage you to try this, Lawrence. It's really hard. It's humbling because you think you're that really strong, and then you're laying on your belly and you're trying to lift your arms up, and it's really hard. So,
is that isometric?
It can be isometric, but we don't usually do isometric. We usually do, full 2, 4, 4, 4 count on that.
Okay.
Yep.
Okay. Great stuff.
And James there is, very muscular. He's a bottom left-hand picture. But the next slide is really a unique exercise, I think, that we do, and a very important one. And a lot of times if you're good at watching movement during exercise, you could really identify where people are weak. And oftentimes, the lower trapezius portion of the trapezius muscle, you can identify its weakness by watching people do biceps, especially bicep curls, especially on a preacher bench. So, and I would say mostly on a preacher bench. So you might see people like rounding their shoulders forward as they are doing their biceps. And if you're constantly coaching them to keep their shoulders down and their sternum up and they're unable to do that, typically they have like a real significant weakness in their lower trap. And most of us, just from having poor posture, have encouraged extremely weak low trap, or maybe just an unawareness of how to contract them. So it's quite amazing how many people have shoulder issues and also have lower trap muscle weakness. Yeah. So there's different ways to do this. My favorite way we have a Nautilus pull down, and it doesn't come straight overhead, which is nice, right? It avoids that impingement position as well. So it's kind of slightly in front of you. You can do this in a variety of different ways, but this machine is nice for it. And we just simply have people hold on to it with their elbows straight and then contract their lower trap muscles. So that picture with James's shirt off is great because you can see his low trap contracting and lighting up there as he brings his shoulder blades down and together without bending his elbows. And then he lets the machine pull him back up as his shoulder blades abduct, come apart, and glide up his thoracic spine, right? So the resistance pulls his straight arms and hands up, making his shoulder blades abduct, and then he contracts his lower trap muscle, pulling his scapula down and together, which can, you can see for sure there, but there's no movement in the elbow. So unlike a straight pull down where you would pull those handles down to the side of your chest, bending your elbows, this is simply scapular movement. And it's hard for people to do. The second picture, go ahead.
Oh, sorry. I'm just curious, can you describe it to me in terms of how this would alleviate or reduce shoulder injury, rehab that?
So really what it does is it just changes your posture. And so a lot of problems stem from poor posture, right? So if you have rounded shoulders and you start moving through your life and you're, getting a hanger to get clothes out of the closet, or you're putting dishes up in the cabinet, it's just over time, you're smashing all this soft tissue. And it's just like the guy who bends over to pick up a pencil and throws out his back. It certainly wasn't that pencil or that one time. It was the years of abuse that got him there, right? Same thing with your shoulder. The shoulder problems we have are usually years of abuse to that shoulder. It wasn't just one thing that happened. It was years of poor posture and movement, poor posture and exercise movement, poor exercise choice, overstretching, but it's usually just years of,
Got it.
A problem. Yeah. So it's more just trying to get everything right, so it's not an issue moving forward any longer. That makes sense. And
it does.
To humble anybody who thinks they're really strong, myself included, lay on a bench and try and lift your arms up in a Y fashion over your head and see if you can even get them to like as high as your head. it's really, really hard. But also one of the most effective things that we've seen in therapy and in our own experience help a shoulder. It's a very advanced exercise though, because you are in that impingement syndrome position, right? You're in that impingement position, bringing your arms up overhead. So you have to completely be pain-free. And we usually do not have weights in it. James is pretty darn strong. He's got like 3 pounds in his hands there, which is a lot for that exercise. But it's a great advanced exercise for lower trap. We call that in therapy, where, in the clinics I used to work at, we used to call it I, T, and Y. So you lay down on your belly and you lift your arms up in extension, humeral extension, and that's your I. And then if you do horizontal abduction, that's your T. And then you do hands up overhead, and that's your Y. And that would be a protocol for shoulder rehab.
I mean, you've mentioned already how someone you respected wasn't a big fan of raising the shoulders above, higher than. Well, is that correct? So, was he against any sort of shrugging type activities as well?
So you mean like a shoulder shrug?
Yeah. So I guess my question I'm trying to get to with this one is, would dumbbell? So I effectively do dumbbell shrugs at the moment for trap development, and I have no issues with those. And that's my current approach to strengthening my traps, which would in turn improve my posture and hopefully rehab this injury. So do you see any issue with that, or are you fine with that?
The only issue I would have with that, Lawrence, is for shoulders that really are having a hard time getting well or are really a chronic problem. We don't, and it's a very, very few people that we've had to do this with, but it's a real thing. We'll set it. So we have a shrug machine. We have the pendulum 5-way neck machine. So our shrug is on there, and we'll set the seat so it bottoms out. So it keeps them in neutral. So they're not getting that humeral stretch. They're not dragging all of that soft tissue away from their acromion with the, like a shrug. Because when you come up, that's your contraction. But then when you come down, that weight is dragging you. So we don't let them stretch. We don't let them go into a stretch. Shoulders that are real chronic are really having a hard time getting well. We just don't let, and they can still contract their trap, right? Maybe not as much of a stretch, maybe not as much of a contraction, but they can still do it. But remember, there's 3 parts to that trap. If you're going to have strong upper trap, you have to have strong lower trap. And most people don't exercise that lower trap.
And you would exercise that lower trap in the way you just described on the pull down, yeah?
Well, after people get used to contracting it, we don't need to do it like that anymore. We can just do it on the pull down machine, right? So we incorporate it into the movement of the pull down. So if somebody just wants to keep that going, but usually once we correct that weakness and people are aware of it, they don't need to continue to train it. We have maybe a handful of people that still have that in their workout routine, even 7, 8, 10 years later. And those are a chronic impingement where it leads them to, adhesive capsulitis or a frozen shoulder. Like we know those people, we have to keep that scapula really mobile. We have to keep all of the posture muscles for that shoulder really, really strong. And it seems to really work well.
All right. And then the final image is just to illustrate to everyone what bad posture looks like. And that's just this cartoon of this chap who's got terrible posture over his computer, which is a lot more common than we want to be. So,
yeah, and that's just driving that point home that, like you said, it's really about posture and stability and just exercises. It's kind of a cute picture.
So I've got a kind of list of things here. I just want to make sure we've address most of the bases. We talked about, why you might want to use these types of exercises and that they reduce the risk to the shoulder. What type of exercises that you advocate. Are there any that you haven't talked about, or is that your repertoire there in terms of all the exercises you might use for someone who's got shoulder issues?
I think that, when the most important thing is when somebody comes to you and they do have a shoulder issue is to address it immediately and make sure that you just got your little list of don'ts and do's. And, it's not going to be the same for every shoulder because shoulders are just, they're unique and they're different, but it is going to fit a pattern and it is going to be the same bucket that you go to because they're not that different, right? At the end of the day, it's usually an itis, it's usually the rotator cuff or the bicep, or, it could be some other AC joint issue, like some kind of anatomical thing. The one interesting fun fact that I wanted to mention to you, which most people don't know about the shoulder, and I learned this the hard way myself, is that when you're born, and I know you're getting ready to have a baby, so you'll appreciate this. When a baby comes through the birth canal, the acromion is actually in 3 pieces. So it's all like fibrous tissue so that the baby could actually fit through the canal. And so it doesn't form into a full bone until we're about 18 or 21 years old. And so
wow.
When I was working, as you all say, across the pond at physio, when I was in the clinic as a physio, I was on a brain injury team, and I had an unruly patient at the time in the parallel bars, and he was trying to throw himself on the floor, and I had a gait belt on him. A gait belt is something you would wrap around someone's waist to help you with transfers or help them walk or something like that. And I remember saying to myself, you are not hitting the floor. And I grabbed the gait belt, and he was a big man. He weighed almost 300 pounds. I picked him up and I threw him back in his wheelchair. And then I was going for a 20-mile bike ride that night. And when I got on my bike and I bent over, my shoulder was killing me from that transfer, but I got on the bike and I couldn't weight bear on my shoulder. It was killing me. And I went and I had an osteochromial. That was the bottom line. I had an x-ray and I had an osteochromial. And what an osteochromial is when your acromion doesn't form in a solid bone and it still is fibrous. I snapped the fibrous tissue in half and I fractured it with that strong contraction. It fractured. And so I learned that as the doctor said, we don't see these except for on an autopsy. Like, how did you do this? And so it was like a really rare surgery and a really rare thing, but I never knew that about the acromion. So I thought I would share it with you.
Yeah, that's super interesting. That's really cool.
Yeah.
One thing we didn't talk about is, which I guess, some people might just make assumptions about this, but in terms of all the exercises you just demonstrated, what type of protocols do you typically follow? Is it a single set? Do you go to failure? Do you want to talk a little bit about that?
We do. We do what I would say a straight up high intensity training program at Rock Solid. So we vary things. Of course, we have variety, but it's definitely, we try and get everybody to failure. Not everybody will go to failure. But we try and get them to, we really try to exploit all 3 levels of contraction: concentric, isometric, and eccentric. So we really want to take people to failure on all 3 levels, but not everyone will let us do that. But even if a joint has an injury, like the back, we especially want to do it. We know that strengthening that joint and strengthening those muscles is the most important thing. So we don't shy away from that, knowing that someone has a history of injury, but we do shy away from that when somebody is injured, when they are hurting, when they have an active injury. We don't push them to failure. We push them to tolerance.
All right. I'm aware of time, and I guess one of the things I wanted to cover off with you is, do you have, you're a big fan of systems, Patty. You and I both love systems. So do you have, I'm curious, when you have someone who's got a shoulder injury come into your studio, when do you see that in your process? Do you see that, for instance, if they come in, is there a, if they're a new person coming in for the first time, do they have a form they have to fill out where they would describe the injury, and how does it work if they're a returning client of a new injury? How do you record that?
Great question. So the very first appointment at Rock Solid Fitness is an assessment. So we don't even do a workout. We just sit down and we get to know them. We go over their health history questionnaire, and we do a really thorough job of, I had a rotator cuff injury and I had therapy. Okay, how is it now? Does it hurt you? If it were to hurt you, when does it hurt you? What motions? And we try and get as much information as we can. And then and then of course we individualize that workout. So if somebody has no issue, great. But if they do have an issue, then we're going to be all over that, setting up their exercise programming. And then the very first question we ask every single returning client is there anything I need to know before we get started today? And that question, they all know. We don't ask them, how are you? We don't ask them, do you have any pain? We don't ask them, did you injure yourself? We just ask a very open, broad question like that. And that's when it is. There's another great question I'll share with you offline. Maybe you want to do some podcast around it or something. But yeah, so that'll tell us. And then, what we do is on our workout card, at the bottom of it, we have medical issues or injuries. And so every single person, we know what's a potential issue. So at the bottom, it stays with them. When we make a new workout card, it populates to the next workout card. And then we do kind of like a very, I don't want to say a soap note, like you would use in medical, it's a subjective kind of information and then objective information and action and plan. That's what the SOAP stands for. But because I came from that background, we keep like what we call a trainer communication form or a TCF with every client. So let's say you came in and I said, hey, is there anything I need to know before we get started today, Lawrence? And you said, last night when I was playing basketball, I was trying to get this guy to not, hit his 3-point shot, and my shoulder, man, I was doing this with my shoulder and it killed me. I'm going to immediately write that on the TCF, the trainer communication form, so that the next trainer who works with you, because we all share clients at Rock Solid Fitness, the next coach who works with you is going to know, all right, Lawrence hurt his shoulder. That's why Patty didn't do shoulder press and had him do front raise instead. And I'm going to make sure that I check in with him and see how he's doing. And so until that shoulder is better, we're going to be writing notes about it.
That's awesome. Thanks for going into such detail on that. And I just want to take this moment as well to mention to those listening that if you're interested in more from Patty, I had Patty and Dave both on to talk about team and hiring and culture, which was a really good podcast, which you can find in the show notes for this one. But also Patty did some great content in the membership. So that's in the Hit Business membership on how to get referrals and testimonials. And also she shared the Rock Solid Fitness sales system, which is really, really good. So I appreciate you contributing that, Patty. What is the best way for people to find out more about you?
I guess our website, which is Rock Solid Fitness FL, which is for Florida.com. So it's rocksolidfitnessfl.com. Of course, anybody can email me at Patty, Patty, at rocksolidfitnessfl.com as well.
Awesome. And to find the more information on the membership, please go to highintensity.com/membership. But to find the blog post for this, please go to highintensitybusiness.com/shoulder. And for all episodes, please go to highintensitybusiness.com/podcast. And until next time, thank you very much for listening.
Discover how to achieve your health and fitness goals, become a great personal trainer, and build a successful high-intensity training business. Check out highintensitybusiness.com. highintensitybusiness.com.